Earlier, we had a conversation about the importance of BMI versus percent body fat. And I made the comment that BMI is used as a reference, but I didn't specifically address how it's used as a reference as it regards surgery procedures. A very popular procedure that we're performing these days, I think I do a butt lift every single week with increasing frequency. Believe it or not, between Friday and Saturday, we actually did 7 cases, and I think 5 out of the 7 involved a butt lift. The BMI less than 31 is considered to be a great candidate for the liposuction, which is an important component of the butt lift. In other words, we harvest your fat, and you have the option of just discarding it or throwing it away or donating it to yourself to either your breast or your butt. These days, with increasing popularity, people are choosing to get lipo, the combination butt lift. I had a patient ask why a family member was not allowed to get a butt lift when they were in fact considering liposuction. And that's because their BMI was greater than 34. So what does BMI have to do with a restriction in getting a butt lift? In the process of performing liposuction, you are actually lying on your back. Once liposuction is completed, we have to lay you on your stomach in order to perform the butt lift. If your BMI is greater than 34, there's a probability that laying on your stomach will push up your diaphragm and you may have trouble breathing when laying on your chest, and that's why we don't do butt lifts in patients with a BMI greater than 34. I should mention at this time, not every surgeon uses anesthesia. We don't put you to sleep, you fall asleep. But in every single case in our practice, 100% of the time, without exceptions, we use anesthesia. My concern is surgery. I'm not trying to monitor the patient, watch their vital signs, and listen to the beep beeps while we are performing surgery. I find this to be the safest approach. It's more expensive, not for the patient, but for me, because we pay the anesthesia and facility fees out of the total that you've paid, which I believe actually to be reasonable and the most safe. And after 30 years of practicing surgery, I'd have to say that that's been one of the smartest moves I've ever made, is guaranteeing the presence of an anesthesiologist in order to monitor the patient. Thank you.